Our healthcare system is great. My mother got sick. They took care of her. I've been sick. It's just been great. Don't have any complaints. My brother had a heart attack.
Do you think that the U.S. should have universal health care?
I do, yeah.
Yes, so do I.
Yeah?
Yes, because healthcare should not be a for-profit business.
How do you feel about the Canadian system?
Fabulous.
I'm old enough to remember when universal health care came in. And as I said, it's not completely universal, but it's there. And I remember, kids dying, going to sick kids hospital and such, because they didn't have the money, they wouldn't treat you. It was crazy. I mean, I can't believe that anybody would even think that it's honorable in any way to not have some sort of baseline for every citizen. It's crazy.
And when did universal health care come into being here?
In the 50s and 60s, in different stages.
Since then?
60s, really.
Has the government become communist?
No, we're pretty capitalist up here. We're pretty capitalist.
Oh my goodness. I grew up in communist country. No way. Oh, yeah. It used to be Czechoslovakia. So no, it's not even close. No.
I've been working up here for 10 years in Canada, and just in going through the health issues that I've gone through and going through the people that are working on my crew, there's no anxiety for anybody on my staff. If they feel a cold coming on, if they don't feel good or whatever may come into their life, they immediately go and go to a clinic or go to a medical center and they get help. Where there's so many people in the United States where that is not an option. They have to get sick enough to go to an emergency room, and then maybe they'll get care. If you have a kind enough staff that'll take them in. So I really can see the difference just in their outlook on what it means for them to get sick, as opposed to people that I know back in the States, and what that can ultimately mean to them when they get sick or a loved one gets sick. And I think the mental anguish is immeasurable, and I think it's really hurting our country in a very negative way.
All in all, I feel very positively about it. My father had an aneurysm that needed immediate treatment. He got it. He was in intensive care for 10 days. The only reason we would have been bankrupt without Canadian health care. I really honestly don't know how Americans can possibly live without a healthcare system like this. With all, there are faults, of course there are, but nothing compared to what I've seen south of the border. For so many years, America has been considered the envy of the world in so many ways, but on this issue, I think that I feel terribly sorry for them. I think they need public health care. I think it is a prerequisite for a civilized country.
I can't say enough about the healthcare system that I experience as a Canadian citizen. Anything that I've needed, anytime I've needed the services of a doctor or my children. For example, my mother had a health crisis 2 years ago. She collapsed at our house on Easter Sunday, and she was 73 then. So she was taken by ambulance to our local hospital in North Vancouver. And my mom saw top specialists in all of the fields, and luckily, presently 2 years after her health crisis, she's doing well.
So if I got pneumonia in the States, it would cost me several $100s. X-rays added up. It was expensive even for me as a nurse to access healthcare in my own business that I worked for. Here, I got pneumonia in July, and it was all taken care of. I saw the physician. I walked into a walk-in clinic, saw a physician in 15 minutes, got an x-ray, got antibiotic, all of it, and it was all taken care of. And I'm obviously well because I'm working today. So it was fantastic. I've only got good things to say, I'm afraid, at this point. I'm very satisfied.
I've never experienced the U.S. healthcare system. Jim has. I quite like my healthcare system. It's something that all of us can basically afford, and you don't need to incur huge private insurance costs in order to have your basic needs and more than basic needs attended to.
And with an appendix, same thing. We went to hospital, we went to emerge, he was triaged, he was seen by, had a CAT scan, seen by a surgeon, and had surgery like 12 hours later. And obviously it wasn't an emergency or acute. So I just thank God every day that I am a Canadian citizen. My sister-in-law has just come from Japan to live here again with my brother, and again they say how lucky we are.
My name is Hugh Fuller. I'm from Hamilton, Ontario.
And Hugh, what do you do for a living?
I think compared to the US, we provide care that, with the exception of wait times, is as good as the US, and we apply it for about half the price. We have a much less cumbersome bureaucracy. We spend much less on administration, and I think we generally do, when they've done direct comparisons, we do well in comparing.
I'm just visiting my grandmother right now, who's 102, and when you live to 102, it's very difficult to have enough money for medical treatment, and even though she doesn't have a lot of money, they treat her absolutely wonderfully, and I absolutely love my grandmother, and I want to say that I'm so glad that she has that care, which I know she would not have in the United States.
We have known people who have had to wait for a while, but it was because it was non-essential operations. But we also have a two-tiered system here. If you have enough money and you want that knee operation done right away, well, you can go have it done, or you can wait the 3 months and get it done then.
On the other hand, we have a friend who has cancer, and he got immediate treatment and was taken, right to the front of the line, and has had exemplary treatment and continues to. So, and his family will not be strapped because of that. His children will not be in a deficit because of that.
I've never had to go to the U.S. in care, and I think every emergency place waits in line. We were back visiting Jim's folks, and his mom waited 6 hours in the emergency room, which is not too unlike what you find in emergency rooms here.
Oh, and that was in the U.S.?
Yeah.
And you, Jim, having experienced both, what do you think?
I much prefer the Canadian. Yeah. It's more about health maintenance than just, getting sick and going to the hospital or the ER. It's much more about taking care of yourself so you don't have to.
I can't talk for BC, but I can talk for Ontario, and physicians will earn somewhere between 150 and 500,000, depending on their specialty.
My difference is I'm making more money here. Thank you. I know, it's fantastic. My taxes are lower too, actually. Well, we're from Oregon.
Say it again.
But the taxes here are lower than they are in Oregon. Now that's because of our property tax,
I prefer the Canadian healthcare system to the U.S. healthcare system. In fact, I think the American system is completely barbaric when it comes right down to it. That's my impression of the American system. Just that you wouldn't support the most disenfranchised people within the community. It's utterly barbaric. It's not even civilized.
Our physicians live very well, and if you want to wait a minute, my husband's a physician and he's coming back with a coffee. You can ask him. No, I think they're very comfortable.
Thank you, Canada. Do you think America should have universal health care?
Yeah, they brag they're the best nation on earth, so why can't they take their own care of their own damn people?
How's the Canadian healthcare system?
The best in the world, lassie.
And how is the Scottish healthcare system?
It's so close second.
Do you ever wish that you had private insurance or could go to the U.S. for care?
Yeah, if you're heat, we've got the best in the world, we're telling you.
No, Betty.
You're just doing your thing, aren't you?
Yeah, I'm tired of hearing that the rest of the world that has universal health care is communist and falling apart.
Yeah, we're a bit tired of that too.